Hello, you're welcome to another episode of the Smart Parenting webinar with Oluwatoyin Ogunkanmi. For those who are just joining, for those who've not been part of any of my webinar before, my name is Oluwatoyin Ogunkanmi. I'm a family psychologist. I work with parents who are struggling to connect with their adolescents, who are struggling to communicate effectively with their adolescents and young adults. I provide them with tools and resources for them to connect and build a strong and healthy relationship. And today I'll be talking about something that is very, very, very important. Something that's very important that parents really need to listen and understand and know what's happening in the lives of their adolescents. And today we're talking about understanding the hidden struggles of adolescents. Understanding the hidden struggles of adolescents. Now, you'll be wondering why am I talking about this? When we talk of hidden struggles, what do I mean by hidden struggles? I'll start by, I'm going to talk about the reason I'm doing this. So I work in a mental health facility as a clinical psychologist there, and I work with young adults and adolescents. And over the years, I've seen quite a number of young adults and adolescents who self-harm and who also sabotage themselves. They have self-sabotaging behaviors. And by the time I have conversations with the parents, most times these parents don't even know that their children are self-harming. And I'm wondering, okay, the child lives with you, and is that you don't look at the child, you don't look at the child's arm, have conversations with these children and all that. But it's not that I'm blaming the parents, because some of these children, they actually hide these symptoms. For those who don't hide these signs, those ones are the ones that are actually crying for help. Now, when we talk about self-harm and self-sabotaging behaviors, what do I mean by this? One of the things we need to know as parents is that the the children we have, the world that children they're living in is quite different. These adolescents are growing in a world that is quite different and vastly different from the world we grew up in. Social media shaping some, shaping how they see themselves, how they relate with one another. And also, social media is amplifying a lot of comparison, rejection, and anxiety. And not just this, even academic pressure, it's also very, very high now. Peer dynamics, a lot of people are moving online. Many people, young people, are navigating complex questions of their identity, belonging, and also the uncertainty of the future. All these actually are causes or reasons why some of these adolescents are struggling. While some adolescents express how they feel, express their struggles, they talk to their parents, they tell everybody, I'm not feeling well, I'm sad, I'm upset. We have so many that suffer in silence, so many that suffer in silence. And their pains may not always appear as sadness or tears, but some you see them getting angry, for some you see them being withdrawn, for some you even see them getting themselves involved in risky behavior and self-harm, self-sabotaging, and for some you see them losing motivation or even hope to do things. And that's why it's important for parents and caregivers to understand what lies beneath everything you're seeing your child doing, and why it's important you should be the first point of call of help for your children. Adolescents want to talk to their parents. This is one thing I know. But due to the way their parents respond, or due to the way their parents have responded to some of their worries in the past, they tend to shy away from speaking with their parents. And that's why we have this session, understanding the hidden struggles of your adolescent. Today's session, we have it's quite packed, and that's why I'm going straight on as we are joining Please, I'd like you to tell us where you're joining from. What part of Nigeria are you watching from? Let's know where you're watching from, what part of Nigeria you're watching from. And not just what part of Nigeria you're watching from. Also, okay, hi Faith. Hi Faith. We have Faith. Thank you, Faith. As we're joining, please tell us where you're watching from. Also, tell us what are your expectations for this session. I'm going to go into watching from Abuja. Thank you so much, Faith. Yes. So I'm going to go straight into the table of content, what we're going to discuss. Then I will define what self harm is. I'll also define what self-sabotaging behaviors are. And I'll go into the reasons adolescents indulge in all this. So, our table of content today, we're going to understand the emotional world of adolescents, explore what really drives your teenagers, what drives their behavior, their emotional responses. We'll talk about what self harm and self sabotaging behaviors are, how you can recognize signs of self harm and self sabotaging behaviors, how you can identify risk factors and triggers, what could be the triggers, how you can respond to your child without judgment, how you can strengthen your emotional connection with your child, and finally, when to seek for professional help. These are all the things we'll be discussing today. So, what really is going on, when it comes to adolescent, in the world of the emotional world of adolescent? One of the things you need to know as parents is that once your child becomes an adolescent, so adolescents are children between the ages of 10 and 24. Some school of thought says children between the ages of 10 and 19. Some school of thought says 10 and 24. And when your child becomes an adolescent, this adolescent period, is a period of neurological, emotional, physical, psychological development. The brain of your child, that's the emotional center, the brain's emotional center, that's the emotional part of the brain, matures faster than the reasoning part of the brain. If you've listened to me talk before about adolescents, you know that I'm always talking about this. And because the emotional brain or the emotional center of your child's brain is more or better developed than their reasoning center, your teenagers tend to feel a lot of extra, so they feel a lot of emotions that are very intense, and most times they tend to struggle to regulate these emotions. For parents who do not know this, you'll be wondering, why is your child snapping? Why does your child have mood swings? Why is your child moving in and out? Why is your child staying in the room? And you're wondering why all these changes. These are part of the changes that come with adolescent years. And for parents who do not understand this, there might be conflict between you and your child. But for parents who understand this but do not know how to help or guide their children in terms of managing or regulating these emotions, might tend to be friction also in the homes. So, what are the common emotional experiences that your children might have that might cause this intense or these big emotions in them? First is the fear of being rejected. One of the characteristics of adolescents is that they want to belong to a social class, they just want to belong to a class, a group, a friend group in school. And when this doesn't happen, they're afraid of rejection. It can build this emotional, big emotions in them. Not just this, fear of rejection and not belonging, having overwhelming pressure to succeed. They want to do well. I want to be the best in my class, or I want to be the best in this sport, or I want to, that pressure alone can be so overwhelming to some of them. And when it becomes overwhelming, and they don't know what to do, some of them result into unhealthy coping mechanisms. Then also the fact that some are confused about the identity, the purpose, and values. These are emotional, the most common emotional experiences your adolescents are going through. That feeling of who am I? That question, and that's one question a lot of adolescents ask. Who am I? How do I fit into the family? How do I fit into the society? How do I fit into school? What's my purpose? What should I just all my friends are going towards this, should I follow them? But no, I don't feel like doing what they're doing. I have my own hobbies. How do I fit my hobbies to my friends' hobbies? All these can cause some sense of confusion for your children. Also, having some children are very, very sensitive to criticism. Any small criticism, they just internalize it, they start ruminating, they keep playing it over and over in their brain. That is another reason for them having big emotions. And also the desire to be seen, to be heard and understood by their parents. That's another reason these adolescents have these big emotions. Now, not all adolescents suffer this. Some might and some might not. And for some, the pains show up differently. Like I said when I started, I said some adolescents, the pains show up as anger and irritability. You see them frequently snapping at family members, outbursts. You see them getting perpetually frustrated. And you see some trying to mask their sadness and fear by pushing parents away, by being angry and not being irritable. For some, you see them withdrawing from family members, from activities, or for even friends. You just see them just being quiet, and they're quiet because they are going through a lot, but they don't know how to tell you, especially if you're that parent that you've not been able to build that emotional connection with your child, or you're that parent that you've not been able to create an open atmosphere where your child can speak to you. You just see the child always in the rooms. At times, you see them crying and asking what is wrong. They'll tell you, oh, nothing, I'm okay, I'm fine. Meanwhile, they're going through stuff. For some, they express this pain by indulging in risky behavior. I remember there was a particular patient I was talking to, right? And the person was telling me about one of the friend. And the person said that this friend is always involved in risky behavior. And she was like, she knows that he's hurting. I was like, are you the therapist? I was just joking with the patient. I was like, are you the therapist? I said, no, I know he's hurting. His parents are not together. You should. So you see some, because they're hurting, you see them engaging in a lot of risky behaviors. And when this happen, parents are wondering, why are you always doing this? And some of these risky behaviors could be substance use. For some of them, could be indulging in reckless decision making, going online. So you see some of the girls posting pictures. There was some reckless behaviors, and they do this maybe as a way of escape, of, okay, I just want to lose control. I just want to get out of the way I feel. Then for some, you see them self-sabotaging, undermining their own success. I remember a particular patient I worked with, and there were a lot of self-sabotaging behavior. And I was like, why are you self-sabotaging yourself? What's the problem? And the person said, I'm afraid to fail. So because this person doesn't want to fail, this person doesn't even try to do anything, because the person doesn't want to fail, right? So you see them undermining their own success, not going for tests, not writing exams when they're meant to write exams, not going for that job interview, because they'll tell you that, what is the essence? I'm going to fail. I was like, but you've not even tried. You've not even put your... So at the back of this child's mind, he or she is going to fail. And that's this. So this emotional pain shows up in different ways. I've spoken about anger and irritability. I've spoken about withdrawal. I've spoken about risky behavior. I've also spoken about self-sabotaging, when they deliberately undermine their own success. They fail to do things. You see some children failing tests on purpose. You see some picking up fights before important events. Why? Because they are just afraid of failure. But today we're going to look at self-harm and self-sabotage. Why do children self-harm? Why do they sabotage? So we're going to talk about what self-harm is. Now, there are two types of self-harm. There's one we call non-suicidal self-injury, and the second one is suicidal self-injury. Now, when you talk about self-harm, what comes to mind? When you hear the word self-harm, what comes to mind? I'd like to want you to put something in the comment section. Let me know that you guys are here. So I know I'm not a radio, When you hear the word self-harm, what comes to mind? Please, can you just put it in the comment section? When you hear the word self-harm, what comes to mind? Are we there? When you hear the word self-harm, what comes to mind? Can you hear me? If you can hear me, please let me know. Can you hear me? Okay. So if you hear the word self-harm, okay, thank you so much. When it says self-harm to me means hurting yourself by yourself. Absolutely. Thank you so much for that. Absolutely. Self-harm means when you hurt yourself deliberately. Okay, thank you so much. We can hear you. Okay, thank you so much. Thanks so much. So when you hear the word self-harm simply means a deliberate and a direct injury to one's own body. And when I was talking about what self-harm is, I said there are two types of self-harm. We have the non-suicidal self-harm and we have the suicidal self-harm. The non-suicidal self-harm is when the child inflicts or when the person inflicts pain on themselves, not because they want to kill themselves. While the other suicidal self-harm is the person is doing it with the intent to unlife himself or herself. Self-harm is a deliberate, direct injuring of one's own body. So you see some cutting themselves, you see some burning themselves, they'll take lighter, they burn themselves. For those that smoke, they take the butt of the cigarette and you see them, putting it on their skin. You see some people scratching their body. They have a small injury, they'll scratch it until they see blood coming out. You see some people hitting themselves. Now, self-harm without suicidal intent is mostly a cry for help. A cry that I'm dying, I'm drowning in pain. I need someone to help me. And for most adolescents, they use this self-harm as a way to cope. So, for example, I've worked with patients who were raped when they were younger, and because the family members couldn't, the family members, they spoke about it to family members, and the family members shut them down, saying, no, it's not possible. How can you say this person raped you? Or how can you say this person is touching you? Come on, stop. Don't say that again. That pain that their family members did not believe them, or their mom or their dad didn't believe them, that pain, so much. So the pain was so much that this person started hurting themselves. For some other people, they use this as a way to numb, they want to feel that emotional, what they're feeling inside. They want to feel it physically. That's when you see them cutting themselves or hurting themselves. For some, it provides just a temporary relief to them. I remember someone saying that she just likes cutting herself because it helps her to feel the pain she's feeling inside. She wants to feel it physically, right? And for parents, please, it's important that I'm going to reach out. I'm going to talk about the signs, what you need to watch out for. But it's important that you speak, have conversations with your children. Don't assume everything is great. You might see a child all smiley, all laughing, but deep down, the child is carrying a lot of pain, a lot of hurt. And that's why I'm having this session, because every time I see a young adult or adolescent in my office with so much pain, and I ask them, have you been able to speak to your parents about this? They always say, no, I can't talk to my mom. When I talk to my mom doesn't understand. My mom is this, my mom is that, and it's so painful. So painful every time I speak with this adolescent and they say, I can't tell my mom. And I'm like, but your mom needs to know that you're going through this pain. So it's very important as parents that please we create that environment where our children can actually speak with us. So self-harm, like I said, is a deliberate and direct injury to one's own body. And what do you see them doing? You see them cutting themselves. You see them burning themselves. You see them hitting themselves, either their head or their arm on the wall, or you see them scratching themselves. You see all sorts of marks on their body, right? Now, self-sabotaging behavior on its own is when the child involves in an action to deliberately undermine their own success or their own well-being or their own goals. Sometimes, for some, they do this unconsciously. For some, they do this consciously. For example, when they procrastinate, you're meant to read for the exam, and because they are afraid of writing the exams and failing, they keep procrastinating. I'll read tomorrow, I'll read next day. And for some parents, you might say, this person is being lazy. The child is actually not being lazy. The child is self-sabotaging. For some other people, you see them picking up fights with friends that are supportive. You see some engaging in risky behaviors. See some dropping out of activities they used to love doing. You see, all these are attempts to just sabotage or to undermine their own success. Both self-harm and self-sabotaging behaviors are signals that something is wrong, and they are not character flaws. I need to know that. They're signals. Your child crying for help. Please, I need help. I need somebody. I need help. I can't do this alone. So it's very important as parents that we, just create that environment for a child to talk to you. So, what are the signs you need to watch out for as parents? What are the signs you need to watch out for to know if your child is self sabotaging or to know if your child is self harming? There are so many signs that you can watch out for, so many. I'm going to start by talking about the physical signs that you can see. Most times, you see these children cutting or burning the non dominant hand. So when I say non-dominant hand, so if your child is a right-handed person, use your right hand, you see them hurting the left hand. If the child is left-handed, you see them hurting the right hand. So what are the signs you can watch out for? Physical signs you can watch out for. Number one, unexplained cuts on their hands, their thighs, their ankle. Some of them be cut by the ankle, some of them the thighs, some of them the arms, some of them their fists. You see them always hitting their hand on the wall, their fist, or hitting their laptop, just unexplainable cuts. You see them, and you see it as a pattern. It's not just a one-off thing. It's like a pattern, and you're wondering, what is happening? Another sign is you're always seeing them wearing long sleeve clothes, especially when the weather is hot, or in the house when they're meant to either wear, maybe a short sleeve or singlet. You see them always wearing long sleeve clothes. You find sharp objects in their rooms like lighter, a razor. I see these things and I wonder, what are you doing with this? What are you doing with this? Right? Now, for the emotional signs, what are the emotional signs you need to watch out for? The child is withdrawn. The child no longer spends time with you. The child is just by himself or by herself in her room. And you're wondering what's happening. Why are you always by yourself? You don't come out to gist with us anymore. The child spends unusual amounts of time alone, especially in the bathroom. Or you hear the child expressing himself or herself as being worthless, not good enough, or I'm a burden, or you see sudden mood swings in the child. You know, 1 minute the child seems fine, the next minute the child feels depressed, distressed, or you find that the child finds it difficult to handle everyday stress or disappointment. Any little disappointment, the child just spirals all around, you know. And these are signs that your child is actually crying for help. But for parents, you tell us, so what is wrong with you? Why are you doing this? Why, but the child is actually crying out for help. Now, what about the signs of self-sabotaging behaviors? What do you see them doing? For some, you see them procrastinating or avoiding to do certain things. Certain things that was, for example, their schoolwork, you see them procrastinating or you see them avoiding to do certain things that will bring success, or you see them pushing away friends, and you just see them on the always ending relationship. Where is this friend? Oh, we're no longer friend. Where is this person? We're not. Why you? What is happening? You know, and they do this. For most people that do this, they push away their friends because they don't want to be hurt. Maybe somebody has hurt them in the past, or somebody has said, maybe a friend that they really respected, that they really loved, said something that really hurt them. And because of that, they stop being, they stop having close friends again. So just see them keep changing their friend group. And I wonder what is happening. The another thing you need to watch out for: negative self-talk, believing they're not good enough, always saying bad things. And you know that this child is smart, you know this child is intelligent, but the child just keeps saying a lot of negative things about themselves. I'm not good enough. Oh, I can't pass. Oh, these people are better than me. You're wondering why are you doing this? Then when they seek short-term, they get themselves involved in a lot of risky and impulsive behavior that will give them a short-term relief. These are things you need to watch out for. Please, parents, very, very important. Your child is hurting. The child is hurting. That's why they're doing this. Okay, thank you so much. So, signs to watch out for. Thank you so much for typing that. Always wearing long sleeve, unexplainable cuts or injury on the arm. Yes, thank you. Finding sharp objects in their rooms. Emotional signs include the child is withdrawn, negative self-talk. The child is always changing friends. The friends you knew last year, they're not the friends you know again this year. Or the friends in first semester, they're not the friends in second semester. And you're wondering and saying, why are you doing this? Why are you changing your friends? These are signs that, yeah, something is not right. Okay, so what's the why behind this behavior? Why do they do this? Why are they cutting themselves? Why are they self-sabotaging? What's the why? And one of the things you need to know as parents is that self-harm is not done, it's not something that they do. It's rarely random. It's not done. It's not something that it's not like a one-off things. It's for this adolescent. It has a function, and the function is to help them to get relief from the emotional pains they're going through. And that's why it's important as parents you help them find healthier ways to address the why behind the behavior. So what are the whys behind the behavior? Number one, emotional regulation. This physical pain temporarily takes their mind off the emotional pain they're having. So they will tell you that. So I've heard them say things like, at least when I'm feeling the pain, it's taking me off the emotional pain I'm feeling. I've had several tell me this. Now, so they will they prefer to nurse a physical pain than to look for ways to deal with the emotional pain they're going through. They'll tell you that, oh, I want to feel something. For some, you hear them say, I just feel numb. I just want to start feeling. I just feel numb. I want to feel. For some other people, the reason behind this behavior is a way of communicating to tell that they are hurting. It's a way of expressing what they are feeling. And for parents who do not understand this, you could just say, why are you cutting yourself? What is wrong with you? Are you possessed? Are you this? Are you that? The child is actually crying out for help. I remember a particular patient that I had, you know, so this particular person, yeah, once in a while we dodged in substance use. But this particular period, the person was doing the substance in the house, and the parents could just see. So when the child came to me, I asked that, I was like, in the past, you didn't need to do it in the house. So what made you start smoking in the house? And the child said I was crying for help. I needed to go to rehab. And my parents didn't understand how deep this addiction was for me. So I needed them to see it. That was why I was bringing it to the house so that they could take me to rehab. So for some children, it's a way of communicating. Like, I need help. I need help. I need help. Right? Then for some, when they feel powerless about things happening in their lives, they use self injury as a way to create physical pain that they can manage. I'm like, why would you want to do this? But this is reasons they give. Now you keep wondering, but this thing, in fact, when I started seeing lots of patients, and so for the last 1 2 years now, I've been seeing a lot of young children as young as 13, as young as 12, cutting themselves. And I'm like, how why is this thing becoming so rampant now in Nigeria? We didn't used to hear about this before. And for me, I would say it has to do with the digital culture, the impact of social media. Online communities, you see some people normalizing self-harm. You see some people talking about it that it's okay. You see children, online talking about it online. For some, I ask them, where did you learn this? I always ask, where, so who taught you about this? Who told you that if you cut yourself, you'll feel better? You hear some of them saying, oh, they saw it online, or that they saw people talking about it online in communities and all that, right? I'm like, but that is not, there are other ways you can um there are other ways you can cope with stress than cutting yourself. But so the advent of social media, the fact that we are now a global village, the fact that everybody, we're all online, we're all connected, like we see what is happening in other climes, other countries, and you see that children in other countries, maybe this is what they do, and it is now, we see it now in Nigeria. And not just that, we have children who've lived in other countries and the parents relocated them back to Nigeria. So I'm talking for those who are in Nigeria now. This is for those who are in Nigeria. So you've seen children in other climes. Maybe the child grew up outside the country and coming to Nigeria, going through one form of stress or the other, and child knows that, oh, I've seen one or two of my friends cutting themselves. Let me try it out too. And remember when I started, I spoke about the two types of self-harm. I said there's one, the non-suicidal self-harm and the suicidal self-harm. Most of the adolescents that self-harm, they don't do it because they want to hurt, they don't want to kill themselves. They just do it because they want to cry for help. But for those who are doing it to unlife themselves, please, that one is, that one, we're going to talk about it, how to seek for professional help. And one of the things I tell this adolescent is that, see, when you cut yourself, you might end up cutting your vein and you start bleeding and the bleeding would not stop. So what will happen, So it's very important as parents that we identify these signs, these physical signs I've spoken about, and also have conversations with them. So the social media and digital culture play a complex role in adolescents self-harming themselves. It has created like a community. They see it online. Some, you hear people talking about it, oh, it's normal. It's not normal. That's what I'm telling you. It's not normal. And the digital space may have deep in isolation. So before your child will come out, you guys will have conversation. But because of social media, because of the phones, the gadgets, digital space has created a lot of gap in family unity. So unlike before, where children will come together, we eat together, but now your daughter is in her room with her laptop, your son is in his room with his devices, the mom, the dad are in different corners of the house, and your parents are not able to know what is happening with their children. And also cyberbullying, because our children are always online, the rate of cyberbullying has increased. The fact that children tend to compare themselves with what they see online has also increased. So these are reasons why we have this thing happening. And it's very important as parents that we have conversations with our children. Let's break the silence. Let's have conversations with them. In case you've noticed any child, any of your children self-harming, it's important that you first of all connect with the child, speak with the child, have conversation, non-judgmental conversation. Do not confront the child. Rather, lead the conversations with empathy. Just listen to the child. Ask questions. Why are you doing? I can see you're going through something right now. Do you want to speak to me about it? How can we solve this? By the time you're using the word we, the child knows that, okay, my mommy wants to help me. Do you understand? And also, please avoid minimizing or dismissing it and say, oh, you will outgrow it. What if the child goes to cut an artery or a vein and that is the end of the child? So please, let's address it without being judgmental. Let's address it with empathy. Let's connect with them so that they can actually open up and speak with us. Let's create a safe space for honesty. If your child knows that you're not going to punish him or her, they will actually be honest with you and tell you what they're going through. And the way you respond matters a lot. If you start shouting, "Yay! Why are you doing this? Do you want to kill yourself?" And escalate everything, the child will just shut down and the child will not talk with you again. So you need to be able to be calm, have a non-judgmental conversation with the child, and ensure that you have ongoing conversation. Don't let it be a one-off thing. Keep asking questions. Okay, what made you do this? What do you think about it? Just ask questions. It's very important that we do this. We cannot just assume that, oh, it's something they'll come out of. They won't come out of it if you don't address it. So what do you do as parents? How can you help the child? First, try to connect with the child, avoid being confrontational, and um, um avoid responding with judgment. Don't respond with judgment. Check the tone you're going to use in speaking with your child. The child needs to feel safe and not evaluated and not feeling as if you are going to be punished or dismissed. Please choose the right moment, find a quiet, private time where it's just you and the child. This is not the time to call siblings or cousins, or to calling on your talk, picking your phone to call your sister. Can you imagine what I just saw my daughter doing? Or can you imagine what I just saw my son doing? No, 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 no. This is the time you have a private conversation with the child. Ask questions. I've noticed lately that, ask questions, lead with curiosity. You're not accusing. You just want to know what is wrong. Is everything okay? Do you want to have a conversation? Do you want to tell me more about it? Do you understand? Ensure that you validate what the child is saying before you start advising. If the child says, "Oh, mom, school is so hard. Mommy, school is so hard," you say, "Oh, I hear you saying school is so hard. Why are you saying school is so hard?" Not by saying, "Come on, stop that rubbish. Why would you say school is hard? Are you the first person to go to school? Other people have been to school with..." No, 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 no. You don't do that. You validate what the child is saying. Acknowledge their feeling. Don't jump into offering solutions. You could say, "Oh, I'm so glad you told me this." Or, I appreciate the fact that you can open up to me and tell me what you're feeling. Validate what the child is saying. You validating it doesn't mean what the child is saying is right, but it just means that you're ready to listen to the child. Please stay calm. Don't get um don't show all your emotion by don't allow your emotion to spill all over the place. You have to stay calm because your child is actually watching you, watching your reaction to gauge whether it's safe to say everything, or I've had some patients where they would do like this. Okay, is that a yes or a no? So they're actually gauging you to see if you're judging them. They want to know, are you judging me? Are you dismissing what I'm saying as not important? Are you going to punish me? They're actually gauging you. And if your reaction is one of you shouting, screaming, and doing all those emotional outbursts, you've lost the child in that instant. The child won't respond. The child won't even want to talk to you again. Thank you so much. Choose the right moment, connect with the child, and respond without judgment. Parents should create a safe space for honesty. Thank you so much. Thank you so much for being our scribe. Thank you so much. Thank you so much. So, what can parents do? So, this is the first step in case you've noticed a child that is self harming. But what about a scenario where your child is not self harming or the child has not started self harming, but you've noticed that the child is isolating himself or the child is saying a lot of negative things? What do you think you can do? What can you do? It's important for parents to build a connecting, a I'm trying to look for the right, a healthy relationship with their children. Very important. It's very important that you create that home environment where your children can speak with you. If you don't have a relationship with your child and your child is going through stuff, either bullying in school, cyberbullying online, or the child has been molested and child doesn't even know how to speak to you about it, it will be very difficult for you to help the child when the child is self-harming. So one of the things you can do to create that home environment for your child, that environment where how can you build a stronger emotional connection with your child? One thing you need to know as parents is that for adolescents that have at least one or two secure relationship with an adult, those children end up not self-harming. If your child has one or two adults that they have a secured relationship with, either their parents, their uncle, or a mentor, these children will not self-harm because they know that they have someone they can speak with. So what are the practical ways you as a parent can build that bond between you and your child? Number one, create daily rituals. Have check-in time with your child. Maybe first thing in the morning or before you go to bed or during the day. Just have time that you check in with your child. Hi, how are you doing today? Would you like to discuss anything with me? Just have that check-in time. Very, very important. Number two is when your child is ready to talk to you, please let's do more of listening than us speaking. Let's listen to them. Let's listen to them. When you listen more, right, than when you talk, it makes them feel heard. It makes them feel seen. But if the only thing you're doing is just you are the one just doing the talking, 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 it will your child won't feel heard or seen. Then as parents, please, there's nothing wrong in you sharing some of your struggles with your children when they see that that you are human, that you have your own vulnerabilities, it will help them to be able to open up to you. But if you have this facade of everything is perfect, you don't make mistakes, the child will not want to come and talk to you because they'll feel as if they are a failure coming to talk to you about their own vulnerabilities. So share one or two of your struggles with them. Remember age appropriate struggles, though, not struggles that they cannot handle, just age appropriate struggles. Then also, when they've spoken to you, respect their privacy because trust is built around you respecting their privacy. So they've spoken to you, they've told you about what is happening to them. This is all the time you now use it as morning devotion topic or use it as what they call this thing, um morning devotion, or use it as what they call this thing, prayer point. No, that's not the time you use it as prayer point, please. That wouldn't be nice. Then Another thing you can do to create that bond is to ensure that you say lovely things to your children. Don't shame them when they talk to you, respect them, listen actively, express love to them. You could tell them, I love you. All right, let them hear that from you. Do you understand? When you are able to, when you build this relationship with your children, it helps them a lot. It helps them a lot. It helps them in knowing that, oh, they have someone to always talk to at home. They have someone they can share their worries with. Very, very important. Now, when do we seek for help? When do we seek for help? It's very important to know that not most self-harm is not um it's not suicidal. Most self-harm. However, when the child starts expressing suicidal thoughts, when the child starts talking of, oh, I want to unlife myself, the child needs to go and see the doctor, mental health facility immediately. Please don't wait. Now, if this self-harm is a co-occurring, it's been going on, you saw the child harming himself maybe last week, you spoke about it, child said, "Oh, I'm not going to do it again." You're seeing another wound, more than 5 times, please, it's time for help. You need to speak to a professional. Also, if this self-harming is occurring with another mental health concern, maybe like depression or anxiety or substance use or trauma, please, you need to get professional help. It's very, very important. Don't say, oh, you're going to pray about it. Yes, we'll pray. Prayer, I love prayers. Prayers work. But there's a place of the professional. There's a place of the professional, the mental health professional, a therapist, behavioral health professionals. They are important. You need to get that. Again, you need to get them to help. It's very, very important. You can't just assume that, oh, the child will get off it. Like I tell parents, it's not something the child would outgrow. I've seen people that have been hurting themselves for years, right? So it's not something that the child is going to outgrow if the child does not get help. Now, what help do you give to the child? So I've spoken about what you should do, how you should address the issue when you've noticed and when you have the conversation with the child. Now, it's not just you speaking with your child about it. There are certain help that the child will need. And the first is, why does this child cut himself? You need to identify what the triggers are. Very important. Identify what the triggers are. After identifying what the triggers are, the next step is, what are the healthy coping mechanisms that you can provide for to help this child come out of this stress? What are those things the child can do? Is it, if it's stress that has to do with, if it's an overwhelming emotion, can the child start journaling? Can the child go and see a therapist? Can the child, there needs to be solution. You can't just say, oh, don't worry, it's not that deep, it's not that deep. It's just you. No, the child might not overcome it. So first is identify the triggers. The second is teach the child coping alternative, helping coping method, right? Also, you need to contact people that can support, a therapist, psychologist, counselor. You need to contact people that can help. Seek professional help, very important. So identify the triggers. So how do you build a safety plan for your child? Identify the triggers, help your child to look for healthy alternates to cope with stress or with those big emotions instead of them cutting themselves. Then you need to contact people that can support, like your therapist, your psychologist, or a counselor. Very important. Seeking professional help is very important. So I'm going to stop here. Do we have any question? One thing you need to know is that, please, recovery is possible. Validating your child's emotion is important. And you also need to know that you are your child's greatest advantage. Why? Because if you have an open channel of communication, your child would always come to you to seek help. And when your child comes to you to seek help, please don't see it as her weakness or his weakness. The child needs help. Help the child to get help. Teach the child how to cope with stress. Teach the child how to cope with overwhelming emotions. Teach the child how to handle cyberbullying. And if the child has gone through any traumatic experience, please also help the child by getting a therapist to work with the child. So I'll be stopping here for today. Thank you so much for all who've joined and those who'll be watching the replay. Thank you so much. We've spoken about understanding the eating struggles of adolescents. I spoke about why adolescents self-harm. I spoke about what self-harm is, what self-sabotaging behaviors are. I spoke about the emotional pressures our children go through, the different emotional pressures our children go through. I've spoken about what you can do as a parent once you've identified that your child is self-harming. I said it's most self-harm is a cry for help. They don't know how to handle what is happening to them. Some of them have been raped, some of them have been sexually abused, and they don't know how to tell you, the parent. And they do this just to feel. Someone says, say that they want to feel the pain, they want to feel the physical pain. You hear some say it's a cry for help. I want my parents to know that there's something happening to me, and they're not saying anything. So when you notice this, it's not the time to confront, it's not the time to shame them, it's not the time to abuse them. And no, this is the time for you to actually listen to them and for you to help them. And I also spoke about teaching your children healthy coping mechanism or healthy coping strategies when they have overwhelming or big emotions. And finally, I spoke about you getting professional help. I'm a psychologist. I work with adolescents and young adults. I'm going to drop my number here in case anyone wants to reach out to me for therapy or for help. That's my number there, 984-77756, and they will attend to you. So I just want to say thank you so much to everyone who's listened. If you have any question before I go, please can drop the question. I think I have like 3 more minutes before I leave. If you have any question, please drop the question down. Like I said, a lot of adolescents are struggling. Some are struggling, they hurt themselves. Some are struggling, they show it as anger, irritability. Some show it by engaging in behaviors that are risky. Some withdraw from them, the family, and from their friend group. So, as parents, please, it's important you're able to identify the signs and also know how to address it. Please, we don't want you addressing it by shouting at them or screaming at them or confronting them. And, no, this is the time you're more empathetic towards them. This is the time where you show them more love and, compassion. Very, very important. So it seems like we don't have any question. Okay, no question. No question. Okay. So thank you so much, everyone. Have a nice evening. Bye.